Welcome to today's program, and thank you for joining us. I'm C. Virginia Fields, former Manhattan Borough President, and currently the founder and president of the National Black Leadership Commission on Health, an organization whose mission is to champion the promotion of health and prevention of diseases, to reduce disparities and achieve equity within the Black community. We achieve our mission through advocacy, policy, and action, with an emphasis on community mobilization and engagement, health and wellness education, leadership training and development, organizational capacity, and technical assistance. We know the importance of health, and we know that without health, we simply cannot do all of the things that we seek to do. These are still extraordinary in challenging times as we are in the midst of this pandemic, COVID-19. And COVID has indeed illuminated historical and racial inequities and brought to the forefront health disparities that disproportionately impact Black lives. It is well documented, systemic, and irrefutable that communities of color are more likely to suffer from conditions like diabetes, cardiovascular disease, obesity, various forms of cancer, HIV/AIDS, mental health, and a myriad of other pre-existing conditions that make the populations more vulnerable to COVID-19. While it's disturbing, unfortunately, it is not surprising that Black people are more at risk of becoming infected, dying at higher rates from the virus than other racial populations. So for Black health, we continue to focus on understanding the impacts of COVID, and especially as it relates to persons living with HIV/AIDS and other health disparities. So today on our show, I am so happy and pleased to welcome Dr. Oni Blackstock, someone who has been a leader on health inequities, COVID, HIV, STD, and currently she is now the founder and executive director of Health Justice. And she recently launched her website and recognized or acknowledged that Health Justice has been created to support healthcare, public health, and other organizations in centering anti-racism with their work in which every human being and every community has the resources needed to achieve optimum health and well-being. So Dr. Blackstock, I welcome you to talk to us not only about your new initiative where you are the founder and executive director of Health Justice, but also your work, your legendary work in HIV, STI, and why you think we are at such a point now that more awareness and education around these issues, and why you think it was important to start health justice.
Yes.
Welcome, Dr. Oni Blackstock.
Thank you so much, Ms. Fields, for having me on. It's really a pleasure to be here. And, I think just like so many people, over this past year, the pandemic has really amplified existing inequities, both health and social inequities that we know exist, and has now brought new inequities in terms of COVID-19, being at risk for infection, as well as death. And so, in my previous role as Assistant Commissioner at the Bureau of HIV, a lot of the work I did obviously was focused on HIV and leading the city's response to the HIV epidemic. But for me, HIV in many ways represents a lens through which I see the world. So seeing all these, inequities, racial inequities, the impact of racism, sexism, homophobia, transphobia. And so a lot of the work that I did as Assistant Commissioner at the Health Department really focused on, advancing workplace equity, as well as ensuring that our work out in the community was done in a way that was equitable. And so in that work, ended up engaging with a number of different consultants, such as consultants from Race Forward and Brown Girl Recovery. And then also at the Health Department, Dr. Mary Bassett, our former Commissioner of Health, had started a Race to Justice initiative where issues of racism and the impact of racism on health outcomes were brought to the forefront. And that sort of gave me license to really advance a lot of this work within the Bureau of HIV. Some of the work that we did included, for instance, we received millions of dollars from the federal government, from the CDC, from the Health Resources Services Administration. And we want to make sure that when we bid those funds out to clinical organizations, as well as other non-clinical community-based organizations, that process of competitive bidding is done in a way that is equitable. We want to ensure that those organizations that are really on the front lines, that are well poised to address the needs of disproportionately impacted communities, Black communities, Latinx communities, people who are trans, people who are men who have sex with men, that we are making sure that those funds are going to the organizations that are uniquely positioned to support these different communities. For a long time, we saw funding go to large organizations that were often had leadership that was not reflective of the communities most impacted by HIV. And so part of the effort was to ensure that we were reaching grassroots organizations. So I know I've said a lot, but that work got me, sort of like stoked the fire for me to get, more involved in health equity work. So much of the work I did was health equity, but to specifically call equity out and anti-racism out. And that, in addition to other inspirations, was what led me to start Health Justice.
Now, you talked a lot about funding, which we know is very true, that the funding for organizations that typically are much smaller than the ones that tend to receive the big bucks to do the work, but they are not physically located in the communities where the most vulnerable populations are. They do not have members on their boards who really look like and can bring forward the need, who are bringing forward the needs in these communities, and the staff does not reflect the culture, the understanding, nor the historical background of the same communities. So how do you plan to address these issues of funding? Because what we see a lot in our work, Dr. Blackstock, is that these organizations are hiring as consultants or outreach workers to come and to go into the community, but they're not really servicing the communities in the way that we know is needed. So how do you see addressing issues like that?
Mm-hmm. Well, some of the work that we did when I led the Bureau of HIV, included, for instance, when organizations are submitting applications and proposals, obviously to get funds from the health department, looking at, giving points when we're reviewing the proposals, giving extra points, deservedly so, to organizations that have leadership that is reflective of the community, giving extra points to organizations that are physically located in those zip codes that have the highest HIV prevalence. And so part of that was really looking back and revising the request for proposal process and the review process to make sure that we were considering these different issues. Another strategy that we had also is to provide some of these smaller organizations that might not necessarily be prepared for a larger grant, maybe because they haven't, expanded the services, they don't necessarily have the capacity yet. We established organizational capacity building grants for smaller grassroots organizations, which provided expertise and how to run an organization, how to be financially independent, how to establish a board, and also allowed this funding to help with expansion of services for these grassroots organizations as they build out their foundation, so that after they've had this organizational capacity funding, they would be able to then apply for those larger grants. They would be better positioned to do that. So just making sure that we are aware of the fact, for instance, that some larger organizations might have grant writers that can maybe present things in a certain way to make it more likely that they get funded. But so we want to know for grassroots organizations, being able to provide and support them and give them those same resources so that they can be competitive.
Yeah, that is very, very important because the grant writing process, as can be very challenging. So then speak to us specifically about the services that you will be providing. I kind of gave an overview of it.
Yes, sure.
Of health justice. So talk to us about the services that will be provided
Sure.
through health justice.
Right. So some of the services include organizational assessments. So, I think especially over the past year, the issues around racial equity have really been brought to the forefront. So a lot of organizations are interested in figuring out what they need to do to transform into more equitable, anti-oppressive organizations. And so one of the services that Health Justice offers is, an analysis or assessment of the organization's policies and practices and structure, and gives recommendations and an action plan around how to begin to help that organization and support that organization to move towards becoming an anti-racist organization. It also provides leadership coaching. So there may be leaders of organizations who are interested in getting more support to develop anti-racist competencies and may feel maybe uncomfortable to do that, in front of all of their staff. So I'd also provide one-on-one equity coaching to organizational leadership. Also online equity trainings, if that's something of interest for an organization, something that could be tailored to the needs of that specific organization. And then lastly, I also give presentations around health equity, white supremacy culture in the workplace, and themes of that nature.
Wow, you're going to be busy.
I know.
Extremely busy.
I need to start building my team with people to help.
And this is on a national scale, I presume, right? You're doing this across the country, or is it just here in New York City?
Yeah. Well, I've been getting some requests from other parts of the country, and I think now that we're also virtual, so many people are virtual, it seems that, people don't care if you can't physically be there with them. They're still wanting to work with you.
That's exciting. The other thing that I wanted to ask you about, and we're going to talk a few minutes about, COVID and HIV as it relates to the current state of the health of Black African Americans. We have heard a lot from associations and groups who never talked about racism, certainly in terms of health being a matter of institutional racism. We've heard now that the American Medical Association has come forward with its statement. We have heard from governors and we have heard from mayors in the height of this pandemic and all of what we have seen around Black Lives Matter. All of that is good, but is it just words? And how do we move them from these words to some real action? American Medical Association, I don't know how old it is, but it is very old and never talked about these issues. So how do we move them just from saying healthcare is a matter of, is related to institutional racism, and how do we move them from just the words to actions? Making some real.
No, I think that's like a great point and a great question. You know, it's interesting you mentioned the AMA. I mean, the AMA, you know, historically has been very problematic. I think they definitely have improved in the last few years in particular. They recently had one of their presidents was a Black woman, and they now have Dr. Letha Maybank, who used to be at the health department, now as their chief equity officer, and she's doing some really transformative and important work there. They played a big role, actually. I don't know if you're familiar with the Flexner report, which sort of put out standards for medical schools and the early part of the last century. And it ended up in having a lot of Black medical schools close as a result. And as a result, there were thousands and thousands of Black doctors that kind of were disappeared, that you know, never had the opportunity to get an education. So it's interesting that you mentioned that. You know, I think we can't force you know, any of these organizations to do the important work of transforming into anti-racist organizations. They have to be willing to engage in what is really long-term, intensive work. You know, I think a lot of what we've heard, as you were mentioning, you know, there's sort of like more superficial and performative sort of head nods to anti-racism and the Black Lives Matter movement. But we need to have organizations that are really willing to invest and invest in transforming the organizations into organizations that center equity. And we can't, they have to be ready to do that on their own. Sometimes, you know, social pressure can do that, but we need to make sure that, you know, there's a commitment from the very beginning. If people are interested in engaging in this work, that they are committed to the entire process, including, you know, whatever if they end up getting a consultant, equity consultant, you know, what are the recommendations that this consultant is providing? And are they willing to really implement these recommendations? And I think a lot of organizations, you know, they're just talking the talk and they're not really walking the walk. And I'm most interested in working with organizations that really want to have meaningful change in their organizational culture.
And you mentioned a phrase that I find all too often is the case, and especially as it relates to looking at issues of structural racism and its impact for far too long, even though it is well documented. But obviously, COVID has amplified it and lifted the veil, as we often say, on structural racism. And we're hearing people talk the talk.
Mm-hmm.
Now we need to have them walk the walk. And that's one of my concerns as the vaccines now seem to be coming more online. And we hope to turn the curve. Turn the curve sooner rather than later, making certain that what COVID has done in terms of lifting the veil does not now just become something in the past. And I think that's one of the biggest challenges that we all face. And so it's going to take leadership of the organization. It's going to take advocacy, the kind of work that we do here at Black Health, and getting policy changes And you mentioned Dr. Maybank, and I'm so happy to see the work that she's continuing to do even after she left New York. So can you talk to us a little bit now about in the midst again of a pandemic, how do you think we should be looking at the state of Black health?
Mm-hmm. Mm-hmm. Yeah, no, I totally agree with you, Ms. Fields. This pandemic has really revealed, very deep-seated inequities that have existed, and then also result and amplified them and resulting in new ones. I think that this isn't our opportunity this is like society's opportunity to do things differently, to not return to the status quo which created these existing inequities. And I think it concerns me that we're not going to use this as an opportunity. I think we see this with the vaccine rollout already. It's pretty early in it. It started in December is when people first started getting vaccinated. And even though it's still early on, we have granted some incomplete data, but what has been very consistent when we look from state to state and jurisdiction to jurisdiction is that Black people are being left behind. And so in order for things to change, racism must explicitly be considered and grappled with and dealt with and called out. When we think about, these prioritizations for vaccines, even within the different prioritization groups, when we look at healthcare workers, Black people and other people of color are most likely to be impacted. And so, in the same way that there's so many policies that don't mention race, but have a disproportionate impact on Black people, we need to make sure that moving forward that race is explicitly discussed and considered. So I think, for instance, with the vaccine rollout, there was actually an article today in CNN, or actually yesterday, that in Alabama, 80% of Black people live in counties where the life expectancy doesn't even reach vaccine eligibility. So vaccine eligibility in Alabama is 75 years. But most Black people in Alabama are not living to 75 years. So we need to think about, how do we adjust and consider the impact of, I said race, but it's really racism on these health outcomes. And it can't just be, Black people saying, listen to us. I mean, we have to continue doing the work that we've always been doing and continue organizing. But we definitely need to have, white people, involved in changing the existing culture and changing the status quo, so that we aren't seeing this disproportionate impact on Black communities.
And I think that was what was partly so exciting and so inspiring, I should say, about the Black Lives Matter protests that were led early on over the last year, raising the awareness and the diversity of the persons we saw along race, along gender, along age. I think really spoke to something that we had not seen in a long time in this country, or even ever in this country. And I think that certainly helped in terms of the outcomes of the election in November. So we need to continue to see that kind of advocacy, the kind of policy, the speaking out as you are doing. And we are just so very, very proud of the work that you are doing. So in the last minute or so that we have, I just want to ask, is there anything you would like to say further about your organization, or where do you think we should be going from here to our viewers, so that the state of Black health is at the top of our agenda?
Right. Yes. So I think that, as the former commissioner at the health department used to say, when you lead with equity, everybody wins. And so what I would love to see is for government, for large institutions, organizations, small and large, to develop equity plans, to really center equity and really begin to engage in this very meaningful work. Because I think what is not realized is that, these systems, like systemic racism, they actually result in the waste of lots of resources, lots of human resource. Brilliant minds, not being able to be used to contribute to society's solutions. So I would just, put a plug in that wherever you viewers are watching, and if you are at an organization and equity is not on the table, is not being discussed, that you are brave and courageous enough to really bring that discussion to the forefront. And I'm happy to provide services if I have the bandwidth to do that, but happy to do talks or provide referrals for folks who are looking to do this work in the workplace and the organization that they're associated with. Thank you so much for having me on. It's been an absolute pleasure, Ms. Fields.
Well, thank you. And I think that you have certainly given all of us a lot of food for thought in terms of what we need to do, what we can do, and you're providing a pathway for us to get to what it is that we, think we want to do. And so I'd like to certainly thank you, Dr. Oni Blackstock, for joining us today, and to wish you all the best in your new endeavors as the founder and executive director of Health Justice. And as you talked about the services that you will be providing, they are most needed now, perhaps more than ever. So I would say, if you would just put up or mention your website in terms of how you could be contacted, that would be helpful.
Yes, thank you. I can be contacted by going to healthjustice.co. So it's not .com, healthjustice, one word, .co. And there's a contact page where you can send me an email or inquire about the services offered.
And thank you. And I certainly want to thank the Manhattan Neighborhood Network that brings these programs to you to better inform you, the viewer, about the important topics that impact all of our lives. So please let your families, your friends, and everyone know about this program. And again, I'm C. Virginia Fields, founding president of the National Black Leadership Commission on Health. Thank you, and thank you, Dr. Blackstock, and we look to see everyone again at the next broadcast.